all that.
Now, if I look at it and it looks not like a lipoma, we can still send it.
Yeah.
But the way this is behaving, the way that it looks.
And I've had another doctor a couple years ago. It's like, how long you had that? It was, by then it's already been 2 or something years. He's like, well, it isn't cancer. You'd
Yeah,
be dead if it was cancer.
this is what these lipomas in the forehead look like.
Okay.
And it's behaving exactly like that.
Okay.
But again, if we don't send it to pathology, we won't know 100% for sure. But I can clinically.
Do you have any idea how much pathology costs? Is it expensive?
It's probably 200, 250 bucks. So it's not horrible, but it's.
Yeah. When you're uninsured, it's
Yeah.
struggling.
I mean, I have no problems in just not sending it. If I was worried about it, I'd say, hey, Joshua, if we're going to take this out, we really need to send it. But it's like I say, I'm not going to push you.
Yeah, I had a niece that had a bump on her head, and it was cancer a few years ago, but I think it probably developed to this size in just a matter of probably weeks or something.
And they behave, usually I mean,
it's pretty firmly attached to my skull. Like, it feels like I'm thinking you're going to have to pry it off.
Well, the place they sit, they sit right down on top of the galea. I'm sorry, underneath the galea. So you have a couple different layers of the scalp.
Okay.
It goes skin, fat, and then there's a muscle layer or an aponeurotic layer called the galea layer. That's the muscle that that's the muscle exactly. It's frontalis muscle up here, and it's one continuous sheet that goes all the way to the back.
Okay.
And right underneath that is this kind of loose tissue. It's fatty tissue, and it's almost like spider webs underneath the galea layer. And that's where they usually live, is right underneath there. And it sits right on top of the periosteum, which is the bone covering at the very bottom. And so you just get through the galea, lift it up, and you just sort of peel it off the bone. You're going to hear a bunch of weird sounds when I'm doing this, just so you know.
Like peeling the rawhide or something.
It is. It's kind of weird because you can hear it really loud because it's transmitting through your skull, and it'll be this kind of cracking, crunching, grinding sound.
So how enjoyable will that be?
let me get this. I'll get this all focused in so that you can get a good YouTube video out there.
You might be in here by yourself because I don't know.
I have to admit, I've never had a patient request to put their surgery on YouTube. I do have a few of my own on YouTube.
Yeah, well there you go. Add to the collection. Have you done this particular type of surgery very much? Or?
This operation?
Yeah.
All the time,
So this is where you're cutting?
I'm just trying
planning on cutting?
Yeah.
You do a facelift while you're at it.
The incision does have to be a little bit longer than the actual, lipoma. So I put it. The problem is you don't have a crease that runs the whole direction. You've got one that runs part way, and then another one that runs part way.
Well, I think part of it's because of the bump pushing the skin out, and it makes it so it doesn't wrinkle.
Alright, this is the hard part.
But it's short-lived.
Any worse than a dental?
No, actually better than a dental.
Okay. I'd be able to handle it.
I went to the dentist. I had my first cavity it was about 6 months ago.
Oh, gee.
And they injected to drill it, and man, it hurt. And they do it so slow. They like stick it in.
Oh yeah.
Wheedle around.
Work it in.
Yeah, a little more, and I'm like, come on, just do it. Stop. Okay, a little pinch here.
Yeah, not a lot better than the dentist. A little bit. Ow. Sorry. The screaming I do later.
Once it's numb, you won't even. So we're thinking 5 PDS and a
6 so
Five,
fast.
6 so fast?
6 so fast.
Okay.
Yeah, we should be okay with that.
So you just kind of have to go all the way around it.
Yeah.
There's no straight shot on the nerve endings.
There's one main nerve that does this area. It comes up from the forehead right here. There's one that comes right above your eye, another one that comes right there. But I got that with the first injection down below, and it gets it mostly.
Do you want another needle on the end?
Just a new screws.
Oh, okay.
Tell me what you're feeling here. Did that hurt you there?
Just a little bit. I feel a little bit of a pinch. You can hear it. A little pinch there.
Okay, that's about it. What do you think? Better or worse than the dentist?
At the first,
It's a lot
it's
more
like,
shots than the dentist. But I hate the dentist one.
Well-
Those are painful.
and I don't think you've had a cavity as big as your lipoma.
No, probably not.
Hopefully not.
Is that thing framed up good?
I'm sorry, did you want that injection on there too? Is it recording now?
Yeah, I think so.
Okay.
It's probably fine. Yeah, it's going numb.
Can you zoom in at all?
The zoom, yeah, I feel it too.
It's if you want to.
Yeah, might as well then. My wife's like, just don't show it to me.
It's pretty good. What do you think of that there? Can you see it at all?
Yeah, it's probably good.
Too close or too far away?
No, it's probably fine.
Okay. That covers your eyes too if that's too bright for you.
Yeah, probably be good.
Why don't you grab that stool?
I'm gonna just reach over.
Yeah, it's funny. I noticed it in the mirror one day. I'm like, what the heck? I got a bump on my head. And then after that, then all of a sudden, lots of people started noticing it. People were always like, did you hit your head? I'm like, yeah, see the bruise?
Well, one of the things with these lipomas is most people's foreheads are pretty flat. And so even a small lipoma will look really big
Oh,
just because it's on a flat contoured area
it gets,
that normally is supposed to.
bulges up all those other layers you're talking about.
That's right.
Okay.
I've been surprised when you take these out that it's sometimes not nearly as big as you expect it to be.
So they don't tend to crumble or anything, right?
No,
So
in
it's-
fact, you really want to get them out as
Yeah.
one single specimen.
Yeah, because
And, but they're pretty easy. They usually have a nice sort of rim surrounding them.
if they were to crumble, then you'd have a chance of it growing back.
That's right.
painting my head orange. Okay. Gotta go to work after.
Josh, I'm gonna have you turn towards me just a little bit. Actually, turn back right there.
Do you have something you can put over my eyes?
Mm-hmm.
Need that. Hold on a second. Okay.
That'll work.
How's that?
That's fine.
Make sure your view's okay on the camera. So it's rolling, right? It says auto and there's a little red dot.
Red dot, yeah.
Okay.
Let's go on. So how's business?
It's good.
You've been out of school for a while, haven't you? It's been
About a year and a half.
yeah.
Long
good.
road.
Takes a while to do it all. doesn't
Yeah,
it?
it does.
That's good that you can be moving, cruising along that quick out of school.
I go to all this school and you come and set up shop and you wonder if anybody's going to show up, you know?
So do you have to do a lot of marketing and whatnot?
You know, for the plastics side of things, you kind of do. It's almost an obligation more than anything. You know, it's funny, there's this perception in medicine that if you're a good doctor, you don't need to market. And that's been the sort of old time perception for many, many years. And it's changing. I mean, it really is.
Yeah, I can kind of feel that.
Can you have some more light insert with that? Yeah, new syringe. It's changing. I mean, in plastics, it has definitely swung. I mean, I don't think there's any respected plastic surgeon. I'm sorry, Cindy, I need this sterility. Yeah, sorry. I don't think there's any respected plastic surgeon anywhere in the country, really, that I know of, that doesn't have a website and do at least some degree of advertising.
Mm-hmm. Well, I noticed driving down the freeway, the billboards, there's every other one. Botox, plastic surgery, this or that, or something.
Yeah, you really have to.
Is there really that? I don't know.
That paradigm has changed, no doubt about it. The other aspects of medicine, you know, like should the OB/GYN doctors be advertising better deliveries and blah blah blah. That's a question we haven't really addressed yet. Tanner Clinic does some. Tanner Clinic's kind of old school, and they're just kind of starting to foray into some aspects of advertising. But you know, again, a lot of the old-time doctors here have that feeling that if you're a good doctor, then everybody's going to tell their friends about you.
I think the way the world's going, it gets to where if you're not, I don't know, keeping up with things, then eventually someone's going to take your business.
Yeah.
No matter what it is. I work at a manufacturing place over here in Clearfield. We make like rock climbing gear, carabiners, ascenders, that kind of stuff.
Is it in the report center?
Yeah, yeah. But it's amazing how many like carabiners we'll make. We'll make between 30 and 50,000 carabiners a month,
Okay.
and they're all sold before we can make them. But
What's the company that you work for?
It's Thompson Manufacturing.